All right, this is Zoom session 2. It is, what is today? Today is September 28th, and we're going to review the test, then go over some material for the next part. All right, let me go to screen share. Here we go. So you should now have our screen, or my screen showing your screen. Okay. Now, let's see what we got here. That's, actually, while I'm at that, while I've got this in mind, let me do this. Back to quizzes. So now you're going to see how we do it when we're control midterm. Edit. You're not supposed to see this page. This is for teachers. Close your eye. No. There we go. Assignment. Yeah, due October 15th.
Yeah, somehow at ProctorU it got put in for September's dates because it was the dates that you have, but it was in September. That it was when I went in and it kept trying to make me take it in September. I go, no, I don't know this stuff. I can't take this test.
Jeez Louise. Okay, so it wasn't me. I'm surprised. Okay.
So I think someone at ProctorU put it in wrong or somewhere along the line.
Probably. I mean, I know that when I filled out the form, I took it directly off of, when I was entering it into the computer.
So,
right.
And I contacted ProctorU and they said, well, you have to contact your teacher because I said, these dates, my syllabus says it's these dates, but you have it these dates.
All right. 12 students, 12 people took it. Okay, let's go to preview. Come on, computer, you can do it. Now, do either of you have any questions on the quiz we just took?
No.
Specific?
Yeah.
OSHA, occupation. I mean, the name tells you what it is. Occupational Safety and Health Act. And their basic job is to protect the work area, which means they are the ones that are going to be telling you whether or not it's too noisy or the chemicals are hazardous, or you have to wear steel-toed shoes, or anything that's supposed to protect you on the job and keep you safe. EPA, Environmental Protection Agency. This is supposed to regulate and control things that are related to our environment and protect us and the environment from poisonous material, hazardous material. Food and drug. The food and drugs are controlled, so you don't, if you're going to be working with chemicals or materials, all of these agencies control everything, not just our field. And we had a couple of students who were, giving the examples of this is what they're doing. Hearing control, infection control is one aspect of these agencies. It's not the primary. HIV. One of the biggest things about HIV, and I lived through this, nobody knew what it was, how it was transmitted, how you caught it. No one knew. So prior to this, and I think most of us remember when we were kids, did the dentist put on gloves when he was checking our teeth and gums? No, he just washed his hands and stuck his fingers in your mouth. He's feeling your gum. It feels a little tender here. Yeah. Physicians, you wash your hands between patients. That's just general hygiene. With HIV, they didn't know if it was airborne, liquid-borne, contact-borne. They didn't know. They didn't know if it was like some kind of a virus where if someone with HIV sat in a chair and then you sat in the chair, you could catch it. This is where all those rumors of, I went to the store and I sat on the toilet and caught, yeah, right. So all of a sudden they started, putting into force washing your hands, wearing gloves, wearing masks. I remember going into an HIV center at one of the hospitals that I was doing consult work with, and they had us put on full gear. Put the OR gown on, gloves, masks, and cap. I mean, to talk about frightening compared to what we used to do, which was you walked in and said, "Hi, how are you?" It was really a scary thing. So because of that scare, they started thinking, well, there's other diseases out there that we don't really know how it's transmitted, or we're not sure. And they started setting up specific guidelines. So that's what was the most important thing about the whole concept of trying to set up infection control. When we didn't know and it scared us, suddenly, I mean, our society is a knee-jerk reaction society. We don't do things on a preventative basis unless something happens that's tragic, and all of a sudden we go, gee, this is a good idea. It's a sad reality, but it's true. Some of the other diseases besides HIV and the AIDS epidemic, in the 70s, you were seeing Legionnaire's disease, you were seeing other reduced immune system diseases that suddenly started cropping up. And once they started cropping up in the reduced resistance people, they started cropping up more in the normal resistance people because it was more prevalent. It was more easily to be exposed to it. So those are some of the diseases. Blood, red and white. I always want to say blue sometimes. I don't know. What are the two main components?
Lymphocyte.
I'm going to throw this one out to you.
I don't know how to say them.
Oh, go ahead. Give it a try.
Erythrocytes.
Lymphocytes.
Leukocytes.
Leukocytes and lymphocytes.
Lymphocytes, okay.
Okay. Leukocytes. Give me one moment. Okay, I'm going to hit pause here for a second. This is Dr. Siegel. May I help you? Okay, I love getting called. They'll sell me a brace for my back. It says medical clinic on it. All right. So leukocytes protect and defend the body from infection. They are called what?
Lymphocytes.
Lymphocytes.
Right.
Lymphocytes.
Yeah. And then if you go to the next question.
B cells and T cells.
Right. Because it gives you actually the answer to the question before. What are the two types of lymphocytes?
Right.
So, yeah, and this is also why I prefer to have the test show up the whole page, because you go back and forth and you can actually logic out what most of the answers are on my test. An antigen, anything that the body detects and says, this is foreign, this is something that doesn't belong here, and it develops antibodies to resist.
Right.
Vaccines, how do they do that? How do they establish resistance? They give the body something to recognize. It's okay, here's an antigen. Be aware, this is not good. And the body starts producing resistance systems. So now it's aware of this. This is why flu shots work. It's saying this type of virus may be showing up, build up a resistance. So if you do catch it, your resistance you've got the reserve sitting there without having to wait until the army gets there. It's that kind of thing. So live vaccine, we used to do live smallpox
Polio.
But nobody knows. I still remember the one where they took the needle and went on your arm, poked the little holes in.
Oh, really?
Yeah, and then they said, don't take the Band-Aid off because somebody can touch it and catch smallpox. Yeah, I'm that old. Okay. One of the others, and I love it when I blank on my own tests.
MMR.
Pardon me?
MMR.
Yes. Mumps, measles, and rubella.
I just had to go through that. I'm 58 years old and I couldn't find any record I ever had it. And so they require it for school. I had to go through that doggone series.
Well, when they do say all kids should have it. You kids, you got 58, baby. 4 weeks. 4 weeks. I turned 69. Oh, anyway, let's see what we got here. Dead vaccine. A lot of the flus. A lot of the
Hep B, which I just went through, right?
Mm-hmm.
I just went through Hep B too. So.
Yep.
Rabies.
Well, actually, if you want to be exposed to rabies, all you have to do is go into Congress. I have to be careful. I can't make political comments. People get bacterial vaccine.
Tetanus.
Tetanus and diphtheria.
Mm-hmm. Diphtheria, right?
Yeah.
Difference between a virus and a bacterium. And this is like one of the biggest differences, and probably one of the things that has helped produce the resistant strains of these things over the years. Because people say, I'm sick, I want to get something. Give me some medicine to make
give them
me better.
antibiotics for it, and they really didn't need antibiotics for it.
Right.
They needed their
Difference
body.
between a virus and a bacterium is a living organism. It is fully independent. Bacteria can live on in an environment on their own. A virus is basically inert. It's sort of like a landmine. Until something triggers it, until it can get in and take over the operating system of a cell, a virus cannot reproduce. A virus doesn't do anything. It just sits there inert. It's basically in stasis. So it has either RNA or DNA, but it doesn't have the full system. Bacterium can split the cells and everything else. So it's a fully operating system. And antibiotics are effective against which one?
Bacterial.
Right. And if you sign out the name, antibiotics for bacterium, Okay. I can actually read this today. Talk about infection control and transmission. Yeah. Difference, route and vehicle.
Well, the vehicle is the one that talks about you got airborne, or what do you call it? Contact, airborne, vector-borne, and then a vehicle, which I would guess maybe a needle. Would that be like a vehicle? Would that what you would mean by a vehicle? Or
anything. This is why they say don't reuse needles, because that can do it. That's a contact, because it would be either in or on the needle surface.
Oh, contact. Okay, gotcha.
So anything that the disease travels on, spit, moisture, the surface, anything, that's the vehicle. The route, scratch, abraded skin, mouth, eyes, all those lovely things that when you're buffing something and it goes up, you can either inhale it and get it in your sinuses. I mean, one of the things that really became a concern to me was I did a lot of hearing aid modifications in-house, was that I would be breathing in this dust. So I started using a mask, or, and I wore glasses, so, I was working with that, but you have to be concerned with that. So basically, one is how it gets into your body, and the other one is what it uses to get there. So it's basically the difference between the car and the road. It's great to have a car, but if you don't have a road, it can't get anywhere. Simple. Okay, MSDS certificate.
Material safety data sheet.
That's right. Those data sheets are what you can look at in reference to, if I am exposed to this in my office, what do I have to do? You have to use the eye wash. You have to use a counter agent. You should use something that is more neutral than acidic or whatever. So it explains to you what it is, what the hazards are, and what your possible reactions might be. Ototoxicity. Again, if you understand what the term is, oto, ear, toxicity, toxic. Something, any kind of medication that is either given or prescribed or you come in contact with, which can either cause damage or death of hair cells. And the hair cells are both the auditory hair cells and the balance hair cells. So anything that is known to do that damage is an ototoxic chemical. 5 reasons we need to be concerned. Well, before it used to be you took the hearing aid, you cleaned it off, and you did these things. We didn't think twice about it. You can have blood in the wax. You can have, you're going from one patient to the other. You're going from one ear to the other. If a patient has a fungus infection in one ear, and you look in that ear, and you take out the hearing aid, and you do something with it, and then you take out the other hearing aid and use the same tools on it, you can very easily transfer a spore of that fungus from one hearing aid to the other, and now the person has a fungus infection in both ears. If they are diabetic, their resistance is reduced. You can transfer something into their ear, and there are cases where people have died from septic shock. So we look at it and we go, well, how bad could it be? It can be pretty bad. The odds of it being that bad are very small, but we have to treat each case as if they're all going to be that bad. If you are almost paranoid about it, even if you're having a bad day and you really don't follow everything to the T, right to the mark, you're still going to be well within the parameters of good infection control procedures. Better to be normally trying to do too much than letting yourself be satisfied with too little. This is a simple review: symbols right and left, X's and O's. I still remember having to explain to an ENT resident at the hospital I did my graduate work in that we didn't have to send them the colored copies. The X's didn't have to be blue to tell the difference between the red 0 and the blue X, because the 0 and the X look different. Yeah, that was an argument we had. They didn't want the carbon copy. They wanted, also, now I talk to people and they don't know what carbon paper is. Okay. Tell me, I walked into an office store and I said, do you have carbon paper for pencil? And they were like, huh? We used to have the blue that you put between papers, so when you wrote on it, yeah.
Right.
All right, we're all in that age, right? Okay. Yeah. But I was there when they invented it. Anyway, 4 components present in all hearing aids.
Microphone, amplifier, battery, and receiver, speaker. Which do you prefer, receiver or speaker?
Receiver, because that's what it's referred to in all of the literature. But you have to keep in mind that the speaker is, and when you're talking to a patient, you have to tell them, this is called a receiver, but it's really the speaker, because they're not going to sit there and try to pick up our jargon. And I've never been able to figure out why they call something that puts the sound out
receiver. It doesn't make sense.
Yeah, but it's receiving the signal from the amplifier and converting. Yeah, okay. Basic hearing aids provide help by modifying intensity. Because very basic hearing aids may not have feedback control, may not have compression circuits, may not have a lot of adjustments on frequency, But what they're doing is they're amplifying things. They're making it louder. Volume control make changes in
Intensity.
intensity. Style of battery. You never see in today's practice?
The eyeglass.
Mercury.
The what?
Mercury batteries.
Oh, mercury.
The reason for that is mercury is a pollutant, and people would dump the batteries into their trash. They would go into the incinerators, and you would get mercury gas going up into the atmosphere. So it was outlawed in the States. Now, of course, the way things are going, the EPA is going to be disbanded, and we're all going to be able to use them again. Okay. So that was that quiz.
So that, real quick, that last question, the answer was mercury?
Mm-hmm.
So I thought on mine you had put eyeglass aids
Body aid. Yeah, body aid.
and body aids
Yeah.
as the answer. I
'Cause
know
it
I
said-
didn't have it right, but that's
Wait a
what
minute. Let me see if I.
Because I thought body aid at first when I read the question, and then I put too much into it, and I put analog because I'm thinking we don't use analog hearing aids anymore.
Well,
and
and that's the thing too, because, and I think I'm going to have to change that question, because at this point, very few, if any, manufacturers make analog hearing aids anymore.
right.
right.
I mean, I should have went with, as the last question, and I was trying to hurry through it.
Oh,
It took me a while to do the test.
you are correct. You are correct. I was reading this as battery. I'm doing really well.
So it is body style, right?
It is body or eyeglass hearing aids.
Okay.
Very few manufacturers make them anymore, if any. I think that if you want an eyeglass hearing aid, there's one European company, an Italian company that makes it, but analog is becoming the dinosaur again. Yeah.
Right. That's what I thought too.
But I think I also gave 5 fudge points to everybody, because now you didn't have the hurricane, but I did, so I wasn't there to answer questions before. That also is why we're only on our second Zoom. Okay. Let's see. Infection control last semester's material. Okay. Now, let's go to this. Get out of the share for now. There we go. Bring that down. A couple of things that I want you to be aware of. Most of the things that we're covering up to this point have been infection control, avoiding contaminating or injuring the patient either by carelessness or just not following through on what these things are. Understanding the difference between cleaning off. I mean, there are certain things that you can do in your office that if you get into the habit of it, your life just becomes much easier because you have a pattern. I used to have the little paper liners for dental trays,
Mm-hmm.
and I had a stack of them. I had them on the desk where the patient was going to be sitting. So if they took the hearing aids out, I'd always go put it right there. Just put it on there. And I could just take that and slide it onto the file and walk out with it. I had the same thing in the lab. I would put the hearing aids on that or just slide that off onto the lab bench. And if I didn't have gloves on, I would put gloves on, and then I would start working on it. Also, when you go to clean it up and get ready to give it back, you take that tray liner, crumple it up, throw it away. You now have clean hearing aids. You go back to the patient and again, you're gloved, you hand it back to them. So these are things that you can get into the habit of. Having hand sanitizer handy, so when you walk into the room without even thinking of it, okay. And if you want to joke with the patient, I used to say to patients, I walk in and I'm doing this, and I say, the only bad thing about the hand sanitizer, it looks like you're going, and they crack up and go, oh, yeah, that's funny. I go, yeah, but, it's better to be safe than sorry. And they're like, oh, yeah, a friend of mine caught this. And great, break the ice, keep the patient calm. If it's a patient that you've seen before, they like it because they know that you do this every time. Following procedure. Procedure is important. If you talk to a physician and they start taking a new patient in and they go through the questions, these are the same questions that they've been asking the same way since they were in med school, because that's how they were trained. That was the procedure they followed. And especially in a clinical setting, procedure is imperative. Okay, now if the session gets cut off short in the middle of my sentence like it did last time, don't worry about it, because it gives me like 45 minutes to 50 minutes and then goes, never mind, and forgets everything. But the next thing we're going to be going into is to review the laws that are involved, the restrictions, because they are not consistent throughout the country. Certain states, if you have a GED, you do 6 months training, you're a hearing aid dispenser. Other states, 6 months training, take a state licensing exam, get licensed. Other states, like Missouri, you have to have the associate's degree now. Personally, I like the associate's degree because it means that you've had the training, you understand the terminology, and you're not a salesman. And that's one of the big problems that this industry has had for years. I knew people who were dispensers who were members of the state association in New Jersey who had a business selling storm windows and decided to go into hearing aids. Okay. Now, he was a good salesman and he had a reasonably good business, but he didn't really understand clinical. Now, are you going to be doing diagnostic work like an audiologist? No. Should you be prepared to do that? No. You're in a position where you are 2 steps above an optician, because not only are you licensed to fit a product and modify a product and adjust a product for the patient's best interest, you are licensed to test. An optician has to refer you to an optometrist. You don't have to refer to an audiologist to do the test unless you're seeing a problem.
Can I ask one thing before
Certainly.
we maybe get cut off?
Mm-hmm.
Because the HIPAA stuff that you talk about, I've not really seen much in all the reading that I've done on HIPAA, and I've Googled it, and I mean, you come up with 15 million different things on HIPAA. Is there some particular place that we need to go to study for the midterm for HIPAA?
No, because HIPAA, I'm basically asking simple questions like, what is the whole concept of HIPAA is that as the patient, you own your records.
Okay.
And if you go somewhere else, I cannot deny you your records. So if you decide to go to another audiologist, I have to provide the notes that you were having problems with this, and here's what I did. And I have to provide that information. Now, the primary difference is there used to be a regulation that if you gave a free hearing test as a dispenser and the patient went to another place, they didn't pay for the test. It was yours. It wasn't theirs. HIPAA, over the time and over the cases, has kind of changed that. But you can be a little resistant, very little, as a dispenser. You can be a little more resistant as an audiologist, but the thing is, an audiologist technically cannot give free hearing tests.
Only like Costco and Sam's Club and Miracle Ear, those kind of places?
They can give free because they have a dispenser providing it.
Okay.
And they do not accept Medicaid or Medicare.
Medicare.
Medicare states that if I were to provide a hearing test to you for free, I should provide a hearing test to every Medicare patient I have coming in the door for free. I can't charge less for a select group. So if I charge a Medicare patient and you have Medicare, I can't give you a free test. I can give you a screening. Oh, yeah, you do have a hearing loss. We should do a complete test. If I do a complete test, it has to be on referral by a physician, because audiologists are not gatekeepers. They cannot just decide to bill Medicare. It's like saying, oh, I think I broke my arm, or I cracked a rib. I'm going to go get an x-ray. You need a referral from your physician or a prescription from your physician for the x-ray. You can't walk into a radiology facility and say, I think, yeah, do an x-ray. You can't do that. So that's one of the fine lines. The dispenser can't bill Medicare. So that's the main difference. But HIPAA basically says you have the right to get this information. It also states for privacy, I, as a provider, cannot release your information to anyone without your permission, which is why they have you sign those HIPAA forms saying, if you don't give me permission to release the information to billing agencies, basically that means that you can't release the audiogram to the manufacturer
Oh.
to order a hearing aid.
Oh, gotcha. Yeah, that's pretty technical.
Because it's not it's their property. So that's why you have to say, yes, I give permission for you to release it to companies or organizations that are required or are needed to get this information.